So sadly, South Africa has a very low organ donation rate, and it's something we're really working on. And currently, there's just under 5,000 people, adults, adolescents, and children, waiting for solid organ transplants, which is a really high number. And it means people are sitting waiting with their lives on hold. Some people on dialysis, some people don't have dialysis, so liver and cardiac patients and lung patients may just be waiting for a second chance in life. And so we are trying to, in this organ donation month, organ awareness month, create the education and the awareness.
Aloysia had her first liver transplant when she was a year and 7 months old. So she was diagnosed with biliary atresia when she was 3 months old, and she waited on the transplant list for about a year and a few months. So her first transplant was the liver transplant, but 12 years after, unfortunately, the transplanted liver was no longer in full function. And then she had required another liver. But this time, with all the medical interventions that was done on Aloysia throughout the years, it has deteriorated her kidneys as well. So with a second transplant, she would require then the kidney and the liver transplant as a combined. So with the most recent transplant, she had the liver and the kidney transplant together as a combined. To people that are considering, still thinking about it, about transplantation, my daughter's living proof, our lives are living proof at what you can do and what has been done for us in terms of transplantation. So Aloysia's life was not just saved once, but twice through two acts of kindness. That's something very inspiring. And I mean, I think the donors' families are they are the most inspiring people for me throughout my life journey. Because to be able to make that decision to give someone a chance at life in a moment of your loss and your despair, that's the truest form of love to all mankind.
So I did a research recently looking at donors and specific to pediatric donors, and this is something that's also been looked at in the adult donors, that they've actually published this in a journal. So there are different things that you need to look. Awareness. Do people know about organ transplantation? So sometimes when this topic is introduced at the end of life of their beloved, it's sort of like, what do you mean organ donation? Like you're going to take, and that we need to create that awareness across the country and globally even. So if people can actually be aware that this is something that is life-giving and life-changing, that gives a second chance to children or adults, is important. The other thing is not just looking at the public, but also looking at the doctors in the hospital. Do they know how to actually refer patients to our coordinators and say, this is a potential person that could be an actual organ donor? It also looks at, do they know how to look after potential donors of transplantation? It's a journey that we actually walk through. It is not just you come in there as a surgeon and you're like, I'm just going to do this operation and actually walk away. That from the start, when you actually meet this family, and that's the beauty when we have collaboration and a multidisciplinary team of the various departments that we actually work with, as we work as a team. So when you actually meet them for the first time, it's first find out, who are they? What is their story? Obviously you have the file that has all the information, but they're not a condition. They're not a disease. They're actually a child with a name that belongs to a family, that belongs to a community in South Africa as a whole. And if we are to prioritize healthcare, that's how we need to actually think of it, that they're not just a disease, but the whole social status is actually affected.